Some will be farmers, some will be politicians. The man who sews my gown is a doctor. He makes the best gown.
We could be facing a crisis of, or shortage of hands in the medical field as we progress.
No, I'm not concerned at all. I'm not worried.
You're not?
We have surplus. If you have surplus, you export.
Importer, exporter, cocoa water.
All right, guys, you're welcome to the podcast. This is Mendem with Super OG, the public enemy, of course. The podcast has been very exciting. I'm sure you're enjoying yourself so far with all the episodes we've put out. The goal is to ensure that we bring content to you that you can enjoy. Well, today on the show, we have someone very, very interesting. Someone, whose story I think we should listen to. A very good friend of mine, all the way back from St. Gregory's College. My guy, his name is Emmanuel Otabor. We call him Otabor. His name is Emmanuel Otabor. Otabor, you're welcome.
Yeah, hi everyone. It's great to be here. It's always a wonderful opportunity to be able to talk, particularly an interesting program like this with one of my guys. So yeah, I'm happy to be here.
All right, we're happy to have you too. So, just to hit the ground running. How have you been? How have you been enjoying life outside Nigeria? Has it been enjoyment, as people usually say?
I think for sure, all like every good thing, basically there's ups and downs. But for the most part, I'll say that the positives far outweigh the negatives. At least we can all agree that anyway, it doesn't even matter whether it's abroad. Anywhere there's constant light alone is a plus. Basically, that's the most important thing. I think that's still the one thing I probably can redefine Nigeria's fortunes. So that constant electricity, constant power supply, that alone is a big boost, to be honest. So yeah, I think it's been great. Been great, I can't deny.
It's been great to have constant light, I guess. But I also have to ask you before we go into the main questions, what has been your biggest culture shock since you moved out of Nigeria?
One of the first things that really hit me was transportation, for example. So I live in sort of like a major city. One of the good things is even before you leave your house, you can see what time the bus is going to be at the bus station. If the bus is going to be there at 7:15, if I leave my house, I know that when I get there at 7:15, more often than not, I will see the bus arrive. And it allows you to sort of be able to plan your time better than, you would have been previously accustomed to. And it applies to many things, not just bus, it applies to train, it applies to so many areas. Like, people are just good with time, right? People are good with time. And coming from Nigeria now, my first few weeks, I found myself running very often to catch the train because it closed the doors like 30 seconds. So if the train is leaving at 7:25, the doors close at 7:24:30.
Wow.
And so yeah, I found myself running all the time until one day I was like, this guy, you have to just start waking up earlier because no one's going to wait for you. If you get there at 7:24:31, you see them closing the doors in front of you and no one's going to open it.
Wow.
So that was a very big
culture shock. No African time.
No African time. And then the other stuff again, which I say still on translation, basically is you're trying to cross the road and zebra crossings actually mean something. I can't get over it. Every single day I stand at those lines and people stop. I can't really just get over it. Like, are you serious? This thing is real. It's not just a painting on the floor. So I think that was one big show. Sometimes I just test it for fun and just walking along, just stand there and just want to test like, will this guy stop? And they always stop.
Oh man, very, very interesting. You know what? Then now let's just get into the main gist. So for a long time now, or for years, I think even from Jonathan's time when we had the Minister of Health say that all doctors don't need to be doctors, like they don't need to practice. Some can be tailors. That's according to the former Isaac Oyewole, the former Minister of Health. Adewole. Yeah. So you have Chris Ngige now also saying that they have enough doctors and lawyers and doctors can go. However, we've also seen the federal government try to block doctors from leaving when I think Saudi Arabia came to try to employ doctors from, I think, was it Lagos or Abuja now? I can't really remember the gist at the time. So the question is, what triggered you to say, you know what, I want to make this move? And is this where you saw yourself being 5 years ago? Was this all part of the plan for you, or did you just have to move?
Nah, I mean, for me, basically, the typical pathway is you go to med school, you do internship training, and then you sort of pick an area to specialize in. One thing I'd already made up my mind, even before I left med school, was after internship, unpacking my bags. I didn't know where I was going. It was either the UK or the US, but I was sure that after internship, I was packing my bags. Because when you're in med school and you're in the system, right, you see things, you get to see what's going on. And the further you go into the system, the more you realize that a lot of people die needless deaths in Nigeria. And the medicine we practice, I'll give it kudos to Nigerian medical education. There's nothing it won't teach you. If you're looking for people that have, knowledge, we call it stuff in medical school. If you're looking for people who have stuff, come to Nigeria. People know things. People have read all sorts of things. But then when I came here, I realized that people may not know the theory about the things they're talking about. But best believe that they've used all the equipment that you have spent your life reading about, right? There's so many things you see, you read, you don't use them. And so as a medical student, you experience the system and you just have to make up mind it. Is this really what I want to see myself doing in 30 years? Medical practice in Nigeria is not even 30 years behind. At least we're probably 50 years behind.
Wow.
Right? People are dying from things that ordinarily shouldn't kill people in this day and time. Right? And so, you see those kind of things, you just set your hand and say, well, I don't think I can do this. Especially if you're someone who really loves medicine and you want to enjoy the practice, Nigeria is not exactly the most ideal place to experience medicine, and that's just true. So, and that's why I've seen that surge. Again, when you're having statements like what the minister said, you just realize that not only are you in a system that doesn't have the right facilities and environment for you to go, those who are supposed to be working for don't even value you. They don't see the need for the system to change. They don't see the need for the system to improve. It's chronic understaffing and they're not concerned. So why subject yourself to that type of horror? And I think that's the biggest motivating factor for most young doctors these days. Just do what you have to do and just get out of the system.
My God, I can't believe I can't really believe all these things you've said, because they're quite startling to just to say the least. Because saying that Nigeria is at least 30 or 50 years behind is really a great indictment. And now, if one is to point a leading problem in Nigerian, the medical sector or the healthcare system in Nigeria, like if you're going to make a list of the first three things, what would you like? What are you going to say? Okay, these first three things are the biggest problems, because we see a lot of times, or the past few times when we've seen strikes happen, we've heard that it's because of the pay, the house, or the resident doctors and the house, whatever, all these terms and whatever. So the question I have, ultimately is, what are the leading problems? If you are 50 years behind, as someone who has gone out and now, is experiencing one of the best healthcare systems in the world, the UK, NHS and what have you. So
I'd say firstly is, let's start with the basics. One important thing that a healthcare system should be able to do is to prevent diseases more than it aims to treat diseases, right? There are different levels of prevention. You have primary prevention, which is you aim to prevent the disease from happening first. You have secondary, where you're aiming to prevent, if the disease happens, let's pick it up early, right? And then you have tertiary prevention, if it had the disease, how can we prevent long-term complications, right? Those are the three major things. Now, preventive medicine in Nigeria is just, I don't even know the word, it's just like our power supply. That's the best way to describe it. It's epileptic at best. Everyone is, we are dying from infectious diseases, which is not really the trend in most parts of the world these days. The world is moving from a stage where people are dying more from what we call chronic illnesses, degenerative diseases, cancers. Those are leading causes of death. But in Nigeria, we are dealing with more infections more than these things. And that's because when it comes to preventing diseases, we're not doing a great job. Now, aside preventing disease, we need to strengthen what we call the primary healthcare system. The primary healthcare system is the first level of care in any level. Most cases that you see that people have in Nigeria can be treated in a primary health center. But think about it. Ask yourself, would you go to, how primary healthcare centers are? would you go to a primary healthcare center in Lagos?
I've even been to one. Let me even tell you now. I've been to one. I was at one in like when I was in Ibadan, when I was still at Ibadan doing my when I was working there. I went to one to treat malaria, and I can tell you that I can't advise even my enemy to go there, because first of all the place was smelling like, and the way the whole setup was even, I felt underappreciated that my office took me there. I won't lie to you. I felt really bad that was where they took me to treat me for, I think it was malaria I had. It was so sad.
Exactly. Think about the leading things that affect Nigerians. It's malaria, it's infection in under 5 children. These things are things that can be treated at primary health level, but we don't even have an effective or functioning primary health care system. And so if people are not close to the primary health care is the gateway to the health system. If people don't have that connection, they're not close to the system, they're not involved, what you find is that, first of all, health-seeking behavior will be poor, health outcomes will be poor. And so we need to revive the primary healthcare system in Nigeria. And I always tell people, it's not about fancy gadgets, it's not about building massive structures, it's the basic things. They always say that you should be able to adapt technologies that are, very culturally relevant for you. Think about things like ambulance, for example. It's not about building or having fancy ambulance. In countries like India, you find places where they use keke, napep and stuff to convey people to the hospital. The goal is to get someone to immediate care. What they've been able to adapt things to their specific situation. What you find in Nigeria is grand ideas, grand projects with meaningless execution. You are in like a very rural community. You say you want to come and build a very massive center, and then you build it. You get there, they don't have gloves, they don't have nothing. It's just a big waste of building. It's small centers. Primary health centers need to be multiple. One of the first things you find out once you move to the UK as a full-time resident is they always ask you to register with your GP. In short, the system is so safeguarded that you can't see a specialist unless your GP refers you. The only other way you can get...
What's the meaning of GP?
So GP is general practitioner, is the family physician. Those are the first people, what the primary care basically in the UK.
Okay.
That's primary care. So they're the ones who coordinate your care. Every single person has a GP. The GP is the one who refers you. You see your GP. If he thinks you need specialized care, he sends you there. When they are done with you, they send you back to him again. So everyone has a GP because you can't get further access to the system without one. Now, what that means is basically like primary healthcare system is well ingrained. It's a center for coordination. Now, another thing about your primary healthcare system again is there are no checks and balances in the Nigerian healthcare system. Everybody is a demigod. The hospital management is everybody. You know how we do out there. Everybody's their own oga. You enter the hospital, the nurse is an oga, the doctor you are meeting for is an oga. Nobody has oversight function. That means when you don't have things like that, there is low quality. There is no quality improvement process. Ideally, you should be able to say, okay, what are we doing? How does this compare to what we should be doing? How can we improve? But we're not doing those checks regularly. No one is finding out whether what we are doing is the right thing. Nobody is looking at ways that we can improve. Nobody say, no, 5 years ago, children under 5 years were likely to die before they done this. How many kids were dying then? How many kids are dying now? What have we done differently? Right, and so if you don't evaluate yourself, you can't go. The quality improvement process, there are no checks and balances. We're not looking at what we are doing wrong and re-evaluating how to improve them. And even when we make plans, we're not implementing appropriately. The other thing I'd say basically, which is sort of the major factor that is driving people apart from is basically like both staff remuneration and staff recruitment with equipment or provision of equipment basically. Now think about this. People, I go on Twitter, as a Nigerian doctor, you are there, you see things, you see comments from general populace, you can understand their frustration, they're angry, they say, Nigerian doctors are this and that. But I've worked in the healthcare system in Nigeria. I can tell you that it's enough to drive anyone mad. When I was doing my internship, even as a doctor, you donate money for people to buy drugs.
Wow.
Right? Because that it was a normal occurrence. Some patients are there, they are dead and dying. That, unless you do something. But the system is not well funded. And so you are taking out of your pocket to pay. Say in Lagos, they still pay you regular salary. Some say then they owe you doctor the salary again. Now, if they were not even paying you, or if they were paying you great than you, that's good. They're not paying you well, and they are owing you what they're paying you. Now, even when you even try to motivate yourself and decide, okay, let me even still go to work, you get there, you don't have the appropriate tools to work with. You can imagine that triple layer of frustration is enough to drive anyone out of the country.
And I think that's like, I even think that alone, or those things you've just listed alone, can even or will even affect the quality of job done at the end of the day. And these are human beings, and these are human beings who may lose their lives or what have you.
Exactly. I mean, think about it. When I was doing my internship, sometimes when you do your call shift, sometimes you're working 72 hours straight. I mean, no matter how smiley you are on the first day, by the time you are getting to the third day, you're already grumpy. You're already getting angry. You're like, what kind of rubbish is this? Right? There are no working hour restrictions. Nobody cares about your welfare. If you collapse there, no one cares. There's nothing, the system is understaffed. UK is a population of almost 60-something million people, and they have more than 350,000 doctors on their register. Nigeria is a country with almost 3 times their population, and they don't even have up to a third of the doctors that they have here. And the ones that are there are leaving, and nobody seems to care about, what are we doing to stem the tide? How can we reverse this process of getting people to stay back? Like I said, if you don't earn enough, if they don't pay you well, but you have tools to work with, you're still likely to stay. But if you don't earn well and then you don't have tools to work with, then there's nothing basically. There's no incentive. Why go through that suffering? You look at those in front of you, even a professor in Nigeria, what they earn as a professor of medicine in Nigeria is just ridiculous.
Do you have an idea of what the average professor earns in the medical field in Nigeria?
I wouldn't know, but I'm guessing that it's definitely sub 1 million in many places, which is quite interesting considering that it takes you almost 10 years just to become a consultant. And getting professorship level alone in medicine, consultants are in many places earn probably less than 600,000 naira. Maybe in the good federal centers, they probably earn more, maybe naira 700. So, but some places pay consultants as low as 450, 500. Now think about it. You're going to medical school for 6-7 years. You've done registration training for another 8 years. So you're talking of someone with 15 years of training, and only to come out and earn what, say, an accounting graduate can probably start well within 5 years of working. If you put in the same amount of effort, so the return on investment is just absolutely ridiculous. Wow. And so you see people working 2, 3, 4 jobs just as a fresh intern. After I completed my internship, I was working almost 2-3 jobs, all in Lagos, just to earn how much. And I wasn't still taking about 350, 400,000 naira, working 2-3 jobs.
Wow.
Right. And so is that a life to live? I don't think so. I don't see any reason. People should stay back. People will stay back, obviously, right? But if you can, do what's best for you. Because if you're thinking of doing what's best for the country, well, I'm sorry, the country is not thinking of doing what's best for you. So unless you're willing to be the sacrificial lamb, then best of luck.
Best of luck. Okay.
It's true. We cannot agree that Nigeria itself is best and brightest.
Okay, so
Nigeria.
Yeah. I have to also ask you now. You've said you've really laid everything down for us, but you've told us, the things that that the government basically needs to address and why you moved. I think for you it was much more clearer than others who had to get to the end, work first, then see it. I think you knew from the job, you knew from when you were almost going to be inducted that you were going to leave Nigeria at some point. I think for you that's what I'm hearing. However, I'd like to ask, I've heard everything you've said so far on on the podcast, but I have to ask you, there must be something you miss now. You must be you can't tell me that you don't miss anything about the Nigerian healthcare system. So is there something you miss about the Nigerian healthcare system that they don't have
about
there?
The Nigerian healthcare system, I don't even know what to I'm struggling to look for positives.
Is it that bad?
I'm serious. I'm struggling to look for positives.
Wow.
It's not bad. It's more than bad.
Wow.
It's more than bad. Let me, one thing that people don't also talk about is the toxic nature or the abusive nature of being a junior doctor in Nigeria.
Oh, really?
Medical medical education in Nigeria, if you talk to most people, is rigged with toxicity, abuse. It's a system where you're constantly belittled and berated by your seniors.
Okay, you know what? Let's you know what? Since you've mentioned that, because I honestly never knew that. I thought maybe when we were hearing about horrible bosses on Twitter the other day, I never knew that.
I'm sure doctors were laughing when you guys.
Yeah. Like I never thought
this
that.
Is something they start to express to you from medicals. You know, you're in class, people are telling you how you're useless. You know, how you can't make it. And then, you know, there's a very strict hierarchy in medical practice. I'm saying, when I say strict, I mean very strict, where, you know, and as a junior doctor in the system, you know, there are so many things that makes you afraid. As an intern, for example, there are documents we need to sign off to ensure that we complete our internship and get a full license. And then you're working under people who constantly threaten not to sign those things off, you know, almost effectively guaranteeing that they have things they call extensions, you know. Someone can give you an extension for frivolous reason. An extension basically means your internship is prolonged by a couple of months without pay.
Wow.
Without pay. Horrible when I say, and you come here, you know, I come to a system here where, you know, the funny thing is, even the so-called Nigerian, you know, seniors, when you meet them here, they all act well. So it's not like we don't know how to behave. It's a system that encourages that today. You come here, you know, you're calling all of them by first name, you're talking to them, you're interacting with you like a human being there. And then you realize that actually, you know, the Nigerian system just has people say it now, you know, you're in Nigeria, you will not line up. You come outside, you start lining up. You know, question is, what about that Nigerian system makes us want to misbehave, makes us want to, you know, to do the kind of things we do, belittle others, insult, all of those things. Again, you look back and you just realize part of it is just frustration. In the end, too, they're frustrated. Yeah. So I'm struggling to find good things about. I'm not joking. Maybe people will find that I'm struggling personally, right? You know, I come here, I walk onto the hospital ward on my first day. I realize that most of my patients are old. They're genuinely old, 80s, 90s. Every single day that I walk to hospital, I'm seeing a 90-something-year-old. And these are normal things, basically. You know, you see them 80s, they're walking on the street. Just by walking to hospital, you can easily tell that the life expectancy in this country is different. Because comparing it to demographics of people who I saw in hospital in Nigeria, mostly people in their 50s or 60s and stuff like that. When you lose a patient at 60 years old here, you're like, oh, that was so young. So maybe someone was 70, you're like, oh, that's still a young man. You know, because the standard of the life expectancy in Nigeria is barely 50, 55 or 54.
Yeah, thereabouts.
Right, and so, you know, you're looking at those things, you're like, this system works, you know, this system works. And you further irritates you, like, if it was that Nigeria needed to invent some special things to make things work, I understand. It's the same thing with electricity. It's not as if, you know, people in the world are not doing it. All the templates possible in life to be able to get this thing sorted. We are not literally inventing electricity. We just need to look at how people have done things and do them. But I don't know. I really can't. I really just can't explain. There's some things about Nigeria that baffle you.
Wow.
It just baffles you. You can't explain it. And it's easy to point to the leaders, but it's even the everyday person. It's all of us, the everyday Nigerian like you and me, right? You go somewhere, you go to the airport, people are begging. You go to the stuff, people will not get things done unless you pay them. You know, people even when people do their job, that sense of expectation, you have to give me money for doing their job. And also, so those are the guys, and you know, we elect people like us. We elect our fellow Nigerians into these offices, right? They are the ones. They are people like you and me. They've been on this side too, and they've gone there too. And so they are building our mindset already in the rest. And when people like us to get there, you know, they will still do the same thing that these guys are doing, because the mindset is gone.
Yeah. I feel you. Man, Otabor, we could go on and on, but you know, I think we're just going to have to leave it here, because I was really hoping for a silver lining to hear one thing that you would have missed about the Nigerian healthcare system. But
I miss Nigeria. I miss living, like again, there's no reason why people like us, young men, there's no reason why we should be leaving home. It's a sad thing to be leaving home, to leave your country and move. Everybody in the country cannot move. Do you understand? Right? Everybody in Nigeria cannot move. So it's a sad thing for you to carry your bag and leave. Because no matter where you go, even if you get a passport for that country, you're always still going to be, you're always going to be in Nigeria. And it's your identity. You can never really be one of them. Right? You always be, if you like, no matter how you think, either you call you Nigeria born British or whatever it is, you can't wipe that Nigerian identity from you. But it's a sad thing that are getting to leave home and moving to a different land. The food is different, the communal life. You can wake up and go to my guy's house and knock. I've been in my apartment for how long? I don't even know my neighbors.
Wow.
Right. Wow. Life is different. That's not a thing. That's not the kind of thing that life is. So I miss that type of Nigeria. I miss waking up knowing that there's a mala down the road somewhere. Right. So I miss Nigeria. But if you narrow and focus on the healthcare system alone, I can't say that I miss anything.
Wow.
I'm very honest. I can't say nothing, absolutely nothing that I miss about the healthcare.
Okay. I guess, fair enough. You've been very, you've been very honest with your assessment of your healthcare system. And we just hope it gets better because at the end of the day, like you rightly said, not everyone can move out, and for those who can move out, whether for better working conditions or for healthcare system, for a better healthcare, because I heard like someone made a joke the other time that in Nigeria you don't have healthcare, what you have is health treatment. you get treatment, you don't get care in Nigeria.
We're just babalaos.
I'm telling you. I
was with, again, it's a short podcast, but like, you look at the whole thing and, like I said, there's still no willingness to tackle the situation. I think that's the most irritating part of all of it. Nigeria shouldn't be losing doctors. We shouldn't be losing doctors. And if we're losing doctors, it's a shame. I hope that things get sorted out.
I hope too.
Maybe 30 years or 40 years, because definitely not in the next 10 years.
Wow. I hope so too. All right, now thank you very much, Otabor, for coming on the podcast to talk to us.
Yeah. Really nice coming on too.
All right, now thank you very much.